Oasis Audio presents The Price of Health by Michael Kinch and Lori Weiman. Foreword by Mark Cuban. Read for you by John Mclain. Foreword by Mark Cuban. Trust. It is at the heart of how all of us deal with pharmaceuticals and the companies that produce them. We want to trust that these companies are making products that do what the label says it does. We want to trust that the companies which create the drugs we take properly educate the doctors that write our prescriptions. And we want to trust that when we get those drugs from our pharmacists, they are priced fairly, even though all evidence suggests otherwise. Examples of extreme pricing abound, including the nauseating exploits of the now jailed pharma bro, Martin Shkreli, who exploited unique features of the pharmaceutical industry to hike the prices of needed medicines by outrageous amounts simply because he could. Likewise, for out-of-patent and overpriced insulin and EpiPens. Overpricing has led to far too many of us not being able to afford our medications, or resorting to rationing, or having to choose between eating or acquiring the drugs we need to survive. It is no surprise that as a country we are outraged at how the pharmaceutical industry has violated our trust and put profits over the health and safety of their fellow citizens. It is not that we all haven't benefited from the many technological and scientific advancements in new drugs, vaccines, and therapies. We certainly have. We have seen diseases conquered and the quality and quantity of our lives improve and expand. For most of recent history, these benefits were affordable and accessible, albeit sometimes with the help of government interventions, such as those that subsidize the costs of childhood vaccines, or at the other end of the spectrum, to help the elderly gain access to medicines via Medicare Part D. That is no longer the case. The unanswered questions, or the questions that the pharmaceutical industry does its best to keep unanswered, are: why, despite all the technological advances and their resultant improved efficiencies and lower costs, have the prices for drugs continued to skyrocket? Why, if the taxpayer-funded National Institute of Health research accounts for the basis of 1/3 of medicines discovered in recent years, are those drugs unaffordably priced? In order to change the pricing of the pharmaceutical industry, we have to get at the heart of why pricing is so outrageous. With funding from my foundation, Michael Kinch from Centers for Research Innovation and Biotechnology at Washington University in St. Louis, and the team at the nonprofit 46 Brooklyn Research have exposed many issues. These are just a few of the questions The Price of Health tries to finally answer. This is a must-read book for those who want to change the course of healthcare in our country. Introduction. Think back 10, 5, or even 2 years ago. What if we told you that a new deadly viral disease was going to take over the world and kill 500,000 people within just 6 months and infect nearly 10 million more around the globe? What if we told you that the virus would puzzle leading infectious disease experts and global public health officials because this virus would not behave like any other before it? And what if we told you that as the infection spread, the symptoms would mutate, becoming more varied and complicated? And what would you think if we told you that this disease would hit the United States worse than it would other parts of the world? The disease would create panic so systemic the government would shut down public life. Businesses everywhere would be told to close and people restricted to their homes. Such actions would topple the economy, devastate Wall Street, and put strains on access to food and consumer goods. After months of isolation, grappling with the loss of jobs, school, and health insurance, tensions would flare, leading to riots and community outrage. But wait, there's more. What if, in the grips of all of this terror and crisis, you learned that as the dedication
Sample complete. Ready to continue?